Hi, this is Dr. Resnick, and I'd like to briefly speak about pharmacogenetics. As we're here at the Jackson Lab Genetic Research Facility, some patients have asked me about it, and ongoing questions come up as far as pharmacogenetic testing and applications. And so today I was reading an article specifically on that in the peer-reviewed medical journal of family practice. And wanted to briefly touch on the main areas as far as the ideas of where it could be used. There is research, and there are some few actually applications that are useful. And so they say, for example, it was thought that such treatments based on pharmacogenetics would presumably reveal individual susceptibility to chronic disease, preventing them, and lead to targeted pharmacotherapies based on individual metabolism, susceptibility to adverse drug effects, and so on. And the title of the article kind of gives away the answer. It says Pharmacogenetic Testing, an Unfulfilled Promise. And that's pretty much where we are overall as far as clinical application of this is. Not to say that there's nothing that it could be developed into. For sure there is. And so there are three main areas. One is gene-based therapy, which exists a little bit for cancer with very modest results, nothing revolutionary there. But there are a few gene-based therapies where actually products of genes are affected by the treatment. The next one is disease prediction, and disease prediction, even though for some things it is becoming more accurate, the bottom line is it shows there's no evidence that this knowledge changes behavior to reduce risk. People continue doing things that they feel like doing overall. And the third area was to find medications that would work better in terms of efficacy of the medication itself, or as far as avoiding side effects based on genetic profile. They give an example, for example, of a Coumadin, a known medication for which there has been a pharmacogenetic test for specific response of the body to the Coumadin. And the bottom line with that is they were able to, using that expensive test, we're able to get to the correct level a little bit faster. However, there is no difference in any kind of clinically relevant outcomes. In other words, neither in the side effects like bleeding nor in the therapeutic effects. It doesn't make a difference that we got to the right point 2 days earlier versus later. So there we are as far as so they say increased cost from an expensive and marginally useful test. And there are other medications for which genetic tests exist, and they mention in the end, even the proponents of the testing say that there is a paucity of randomized controlled trials on the use of pharmacogenetic testing, and family physicians should not naively accept a new technology because it is the latest trend. So the most effective things are still the simplest but hardest to do. It's lifestyle changes. Today someone asks me what I can do to prevent osteoporosis, and it's simple: exercise, take adequate vitamin D, exercise both for bone strengthening, the strength exercises, impact exercises, and balance exercises, and so on. Diet, exercise, and peaceful state of mind. Thank you, and hope everyone will rely more on themselves and their own capacity to improve their health than on various testing, even though the testing does offer some promise.